Dr. Carlos del Rio is Executive Associate Dean at the Emory School of Medicine and Grady Health System. He joins me from London. Dr. del Rio, welcome to the program. Just want to get your reaction to this. Was this the right time to lift those mask mandates, or is this simply too soon, considering the rising COVID cases from Omicron we're seeing in a number of states?
You know, you never know when the right time is going to be. But I think now that we have vaccines, we have treatments, we have other things, I think it's probably the right move. It may be a little premature, but at the end of the day, you know, we have to move on. And I think this was probably one of the many steps. I think maybe the right one, but maybe a little too soon.
Do you think perhaps the reaction might have been different or less polarized if it had come from the CDC and not a federal judge in Florida?
Yes, I strongly worry that a federal judge is making public health decisions. We need to leave the public health decisions to the public health agencies. And that, to me, is actually the biggest concern. I'm less concerned about the mask and no mask because people can still wear their mask if they want to. I'm more concerned about taking the authority away from CDC, which is the public health agency, and that has the scientific knowledge to make this kind of decisions.
Let me tell you what Delta Airlines, one of the biggest airlines in this country, they put out a statement that got a lot of backlash. Granted, they changed that statement, but I just want to read to you what they said. This is from Delta. We are relieved to see the U.S. mask mandate lift to facilitate global travel as COVID-19 has transitioned to an ordinary seasonal virus. Inaccurate and misleading?
Well, I will first start by saying that I'm a medical advisor to Delta Airlines in COVID-related issues.
Okay.
And on a Delta flight, when that statement was put, I had no input into the statement. And as soon as I landed in London, I sent an email to Delta headquarters telling them that I didn't agree with the statement, and it was changed. So it was a mistake. It was done without consulting with the contact experts. And once they did that, the statement was changed, and I'm very happy that they pivoted.
And I appreciate you being transparent about that. And obviously, what you say, it made a difference because they put out a different statement. Dr. del Rio, will you yourself continue to wear a mask when you travel?
Yes, I will, but I will make sure that I'm wearing the right mask, right? You need to wear a high-quality mask, but I would also say that once you're in the air and once the doors close, the engines are running, the air ventilation system is working, I think you can be pretty comfortable taking your mask off, and that's what I do to eat, to have a drink. But during the time, I think the most worrisome times to me is when you're planing and deplaning. That's when the air ventilation system is not running, and when there's crowding in the aisles of the plane. And that's a time I really think people should be wearing a mask without doubt.
I want to pick up on something you said earlier about this decision from the federal judge in Florida, about your concern that perhaps it undercuts the CDC's authority come another health crisis, another pandemic. The CDC makes a decision. I mean, is another judge going to override that decision?
Well, I don't know, but again, it's what happened now and what's happened yesterday. And in my mind, we need to get judges not to be, making those kind of decisions.
All right, Dr. Carlos del Rio, we certainly appreciate it. Thank you so much.
Take care.